Hello everyone, my name is Dom Hebblethwaite and I'm Head of Membership at the Chartered Institute of Linguists, CIOL. I'm delighted to welcome you all to our online roundtable on machine translation and AI use in public services. Today we will explore the findings of the just published and truly groundbreaking survey conducted by the University of Bristol in partnership with CIOL, which examines the current use of unedited machine translation as a communication tool in UK public services across a range of sectors, health and social care settings, but also legal and emergency services and the police. So without further ado, I'd like to introduce you to our panelists for this roundtable. And first of all, I'm delighted to welcome Dr. Lucas Nunes Vieira, Associate Professor in Translation Studies at the University of Bristol and the lead researcher on this project. His research is about machine translation and its impact on cognitive processes, professional standards, and communication. Lucas conducted the 2024 survey as part of the ongoing Critical Language Barriers project, supported by CIOL and also funded by the UK's Arts and Humanities Research Council. Lucas will be presenting the key findings from the preliminary report. Lucas, welcome. How are you today?
Thank you. I'm great, thanks, and hi everyone. Really glad to be here.
Very good to have you. So next up, we have Professor Lynn Bowker, who is Canada Research Chair in Translation, Technologies and Society at the Université Laval in Quebec. Her principal research areas include translation technologies, language for special purposes, and scholarly and science communication. Previously, she was full professor at the University of Ottawa, as well as lecturer at Dublin City University. Lynn, along with our next panelist, Mary, is one of the two reviewers of the preliminary report. Lynn, thank you for being here. How are you?
I'm very well, thank you, Dom, and I am excited for this conversation.
Absolutely, wonderful. Okay. And so last but not least, Dr. Mary Nurminen, University Instructor of Translation at Tampere University in Finland. Her research is on how non-translators use machine translation in their everyday lives or at work. Prior to her 11 years in academia, Mary worked in the private sector, both with Nokia and then with one of the biggest LSPs in the world as a solution architect for Lionbridge. Mary, it's great to have you with us. How are you today?
Thanks, Dom. I'm doing fine. And as Lynn said, I'm looking forward to this conversation about a very interesting survey that Lucas has done.
Absolutely. Okay, so allow me to briefly outline the format for today's roundtable. We've got a very large audience joining us for this event. We'll start with a presentation by Lucas on the key findings of this very important survey, as Mary said. And getting contributions along the way from Lynn and Mary. To manage this roundtable effectively, all attendee cameras and microphones have been switched off. There will be time for Q&A at the end, so please submit your questions via the questions panel, the chat panel, and we will address as many as we can. Okay, so to start us off, we're going to have 3 quick polls to help understand you, our audience, a bit better. All our polls are anonymous. We do not keep the results or use them for any other purposes other than getting a feel for you, our audience, and then hopefully providing you with the most useful information possible. So Sahela, could I ask you to load the first poll? Okay, so where are you based? UK, Europe, Americas, Asia and Middle East, rest of the world. Please, if you could get your votes in there. And if you don't feel well covered by these options, please let us know in the chat facility as well. Okay, so we'll keep this going a little bit longer. And yeah, if we could have the results, please. Okay. So as you may be able to see, we have 55% in the UK, 28% in Europe, and then the remainder coming from Asia, Middle East, and the rest of the world. We'd love to know, by the way, where you are in the world in the chat facility, as I just said. Okay, great. Thank you for that. So number 2, poll number 2, please. What is your profession? Again, we can only list 5 options here, so apologies if we've not covered you, but as you can see, translator, interpreter, academic, working in public services, or other. We'll keep that open for another sort of 7 or 8 seconds, just to give everybody who wants to time to get their vote in. And we'll send just another couple of seconds. Yes, that's fine. Okay, so 52% translator, 12% interpreter, 20% academic, 8% working in the public services, and 7% others. So thank you very much for that, and a mixed audience. That is absolutely fantastic. And our final question, poll question, please. Okay, and just to stress, this is in terms of any kind of use of AIMT tools. This is not in reference to, you know, controversies around using AI in the law courts or anything. This is any use by any public service worker, whatever that may be. So what are your views around routine use? Is it never acceptable? Is it wrong, but it will happen anyway? Is it always acceptable? Acceptable for low stakes work with policies and guidance, or you're not sure? Any answer is fine, of course. So we'll keep this open for 5 seconds or so, open a bit longer. Couple of seconds. Okay, thank you, Sahela. Okay, never acceptable, 6%. Wrong, but will happen anyway, 21%. Always acceptable, the super optimists at 6%. 50% say acceptable for low stakes work with policies and guidance. 17% unsure at this stage. Thank you very, very much for all of those. And that's really very, very interesting and helpful for us as we move along with this roundtable. So at this stage, Lucas, we are ready to come over to you. You may begin your presentation, and other panelists, I suggest we turn our cameras off at this stage.
Hi, so I think this is working, we're good. So I'm going to start by giving you some background about this survey that came out in this report, because prior to that survey, I think we all knew that machine translation was used on an ad hoc basis in public services and other high stakes contexts, but the evidence that we had for that tended to be a bit piecemeal, right? Depending on cases that ended up in the courts, for instance, in the US, we had a few examples with police officers, etc. And in 2019, I conducted another survey that was that looked at general uses of machine translation in everyday life. So this was with 3 other colleagues. And we came across examples like this one, even though we were not looking for any instances of machine translation use in public services or in high stakes contexts at all. So this was a mental health advocate who had been using Google Translate to interact with patients who had been sectioned under the Mental Health Act in the UK. So when someone is sectioned, they are forced to stay in hospital, right? And they will have a number of rights when they find themselves in that situation. And those rights need to be explained to them. So as this mental health advocate says here, the Google translations that were provided at the time were almost unintelligible. And when it comes to that terminology around being sectioned, etc., I can tell you, because I've been doing a few analyses on this, most machine translation systems still get this wrong, even nowadays. So the data was from 2019, but I think what this mental health advocate says here probably still stands in most cases. So it were examples like this sort of prompted this project funded by the AHRC to look specifically at public services and how and the extent to which machine translation is being used in these services. So the survey targeted a few specific sectors. So specifically healthcare, social care, emergency services, legal services, and the police. So I'm calling these sectors public service contexts, but I think it's important to emphasize that not all public services are covered here, and not necessarily all these services are publicly funded directly or publicly, or directly provided by the government, right? So my sort of approach to public services is a bit broader in the sense of services that are available and may be needed by any member of the community, and it's important for any member of the community to have access to these services, right? So we received 2,520 responses from professionals in these sectors. Most of the sample is in healthcare, I should say, health and social care. And that to a large extent mirrors the national picture, with the NHS being the largest employer in the UK. And what we found is that about a third of these professionals had used machine translation in their work. Some of them infrequently, but some of them also, quite frequently. So this extent of machine translation use did not surprise me because of the amount of, I think, piecemeal evidence that we had. But I think it's the first time that we're able to put an estimate to how much machine translation use is going on in these sectors in the UK. So to say a few words about the participating professionals and about some of the methodology for the survey, I would invite you to look at the report for the full details of the method, because it's explained in a lot more detail there. But I used the prolific.com pool of research participants. So this is a pre-existing database of individuals who have registered their interest to take part in research. And then it's possible for you to target specific demographics within that database and select individuals who are then going to be invited to take part in your study. So I pre-selected those sectors that I've just shown, and then looking at the actual sample that was received, these are the main professions in that sample. So nurses, social workers, doctors, police officers, solicitors, and paramedics. There are many other roles, but these were sort of the prototypical ones, the most frequent ones. The vast majority of these professionals were native speakers of English, and the majority of the professionals had a higher education degree as well, which I don't think is surprising given the nature of these professional areas. So looking at the context of machine translation use and the purpose, so in most cases, machine translation tools were used in face-to-face communication, so communicating with others in a shared physical space. This is slightly different from other surveys and other results that we have from previous research, because if you look at machine translation use in everyday life, what you will tend to find is that most often it's used to understand information, to consume information, right? And this was, a prominent use in this sample as well, 45%, but more common in sort of face-to-face interaction in frontline tasks. And that could be interacting with members of the public or translating public-facing information, so leaflets, letters to be sent to patients, that sort of thing. I was also interested in who was making the decision to use machine translation. And in most cases, it were the professionals on the ground who, based on the circumstances they were in, decided to use machine translation. But in some cases, they declared that it was the procedure recommended by their employer. And also, I think unsurprisingly, other individuals could start using the technology and then the professionals would just carry on using it. So the use would be initiated by others, often service users. So of these results, I think the fact that some of them said that it was recommended by their employer, this surprised me slightly. Because when you look at the very limited sort of official guidance that we have in the UK, or the very limited sort of official positions that we have from institutions, you will often find that machine translation is not used. You often find declarations that it's not endorsed, it's not recommended. But the message coming directly from these professionals here is slightly more nuanced. And I should say as well that when you look at the open text responses that they provided and explanations that they provided about this, they were not talking about formal directives here coming from the top down within the institutions. They were talking much more about what their colleagues told them to try, or perhaps what they were told to try when interpreters were not available, or in situations where they couldn't grab hold of professional language services. So there were caveats in these recommendations, and these the general sense was that these were informal recommendations as well. What colleagues were doing, what colleagues suggested them to try. Looking at the methods and how these tools were accessed. So I think one of the alarming findings, I mean, there are others, but I think one alarming finding from the report is that in many cases, these professionals were using machine translation on their own personal devices, right? So personal smartphones, etc. And often using openly available web browsers. So there are implications of these using these interfaces in terms of privacy, confidentiality, data protection, etc. So this is one sort of area to flag in the findings. By a very large margin, Google Translate was the tool that was used most often. Although chatbots like ChatGPT also ranked highly, even though quite behind Google Translate here. Although I would expect these figures to change quite significantly in coming years as large language models become even more common than they already are. And another, I think, important finding from the report is that machine translation was often combined with other methods of communicating across a language barrier. So I asked them whether they used machine translation together with other methods, and in most cases they did. And the other methods were things like other individuals who spoke the language, or Googling the information, web searching aspects of the translation to try and double check it, etc. And I suppose that in direct interactions with others in a physical space, there will also be an element of body language using objects from the environment. So there are a few examples from physiotherapists, for instance, where just the body does most of the talking in that case when you need to lift the leg, etc., lift your arm, etc. So there are more specific examples like that, which I'm happy to discuss later. Looking here at the professional satisfaction with machine translation, here's a very clear message, right? This is a technology that is highly valued, it's highly liked, and there was a very high level of consistency in the sample in how appreciated machine translation tools were. So they were provided with a number of statements, and most of the sample tended to agree with the positive statements about machine translation and tended to disagree with the negative one. So a very, very clear picture here. I was also interested in how confident they were that machine translation could be used successfully. And most of the participating professionals were at least somewhat confident, if not confident and very confident, despite the fact that machine translation was rarely mentioned in any workplace training. And this is another, I think, important finding from the report, which is the lack of support for public service professionals in terms of how to navigate the extremely complex questions around language barriers and around uses of technology in very high stakes and high stress situations that they will often find themselves in. And this is another area that I think we can come back to later as well. So I'll end by saying that this is an extremely complex problem, and I think that there's always a risk that we can simplify this problem a little too much. I think one risk that we have is to just frame this question as a case of language professionals versus technology. I think that framing risks leaving out many important factors in this discussion, not least because some of these uses of machine translation would not have been supported by language professionals in the first place. So the report is just a preliminary sort of summary of the data, right? It doesn't go into a lot of detail about open text responses, but I'm happy to share some of those details here. So this is one example. provided by a nurse, who was explaining how machine translation was used. So speaking to a relative to explain visiting times for the unit I worked on, the patient spoke very good English, however, was in theater at the time the relative turned up. So here machine translation was used to speak to a family member. The patient spoke good English and there were no language barriers there. And the family member turned up unannounced. I would doubt that the natural course of action in that case would be to get a language professional, get an interpreter on the line to communicate with that family member, which does not mean that machine translation use is entirely risk-free in that interaction either. You know, miscommunication could cause a lot of anxiety for that family member, could cause distress because, you know, their relative was in theater, probably going through, you know, a serious medical procedure. So very rarely we're going to find situations in these sectors that are entirely risk-free, right? Another example is explaining something to a parent that doesn't understand English or navigating them around the hospital. So how to find their way around the hospital. So very sort of ad hoc purposes that would be unlikely to be supported by language professionals here. And also things like, reports by professionals who mentioned lack of access to language professionals. And here we start getting into, I think, the more serious examples, and there were many of them as well. So giving people information about, so I'm reading a description of how machine translation was used. So giving people information about their rights when interpreter is not available. Phrases like this one, when I could not access interpreters, or when signal was too weak and I couldn't get a reliable line to remote interpreters, or when the app that we used to access interpreters crashed. Those were quite common in the sample. So I think we need to talk about funding and availability of professional language services, I think, together with this broader subject as well. I think it's important not to decouple the question of professional language services in this conversation when we look at some of these uses. But then it's, well, two things here. I think when looking at some of these uses of machine translation where perhaps language professionals would not have been involved in the first place, it's really difficult to draw a line between what is just peripheral ad hoc communication and what then can turn into a more high stakes interaction. So if you think of the work done by receptionists and secretaries, etc., I've been told test results at my GP by the receptionist who was on duty at the time, for instance. I would not consider that type of interaction to be low stakes necessarily. I've seen patients in my GP practice being told that they were diabetic in front of the entire waiting room. So in a situation like that, we can't think necessarily of roles, you know, oh, receptionists, they will just have admin communication with patients or service users, and therefore it may be acceptable in these cases. It's really difficult to draw that line. And then there were obviously the examples that were just, you know, outright concerning and problematic. So things like pharmacists using it to prescribe medication. And we know that pharmacists are playing a larger role in the UK at the moment. Using the use of it in hospital for needs assessments, history taking, translating previous medical records from other countries to add that to the NHS record, for instance. Police officers speaking to drivers who did not speak English, or just trying to understand what happened before they even knew what to do afterwards, etc. So very complex communicative contexts that are hard to predict, and therefore I think it's hard to provide a formula of behavior for these situations. But I think that one other, I suppose, message from this research is that machine translation use tends to go under the radar in all these cases because we have a dearth of official guidance, a dearth of policy, right? So the idea of the survey is not to provide a model of behavior or a list of best practices to follow, but there are sort of broad recommendations here. And I think the first one is to address that issue of machine translation use going under the radar. I think we need to take this out in the open. It needs to be discussed openly. It needs to be mentioned in training, staff communication, the organization's literature. I think institutions need to recognize, one, that this technology exists, and two, that that members of staff will be inclined to use it because it is easily accessible. It's in our pockets. It's easy to use. It's convenient, and sometimes it works, right? So I think it's important to discuss this openly. So this needs to be addressed in policy. We have very few policies that cover machine translation for these cases in the UK. And also, what I think is absolutely central to all of this, and probably the key to dealing with this issue, I think, in following years, which is education, right? So staff training. I think it's important perhaps for policies, for instance, to specify what kind of training, what kind of support needs to be in place for these public service professionals. Because one, I think, danger of just doing this kind of research as well is I wouldn't want this discussion to be framed as a way of criticizing public service workers or punishing public service workers, much worse. That I think any discussions around this subject need to be around support, because these will be professionals who will often be doing the best they can in very difficult circumstances with limited funding and as the survey shows, limited access to professional language services as well. So I think the approach to the subject needs to be supportive rather than punitive. So I'll stop here for now. And next, and huge thanks to Lynn and Mary for their input into this report. I'm very, very grateful. And you will hear from them now, I think, starting with Lynn.
Thank you very much, Lucas. Thank you for that really clear overview of the results of your very important work and the recommendations, which I fully support and look forward to discussing in more detail. When I was invited to participate in the round table, one of the suggestions was that it would be interesting to present comparator data from my region, so from Canada, for example. But I have to say that Lucas is a real trailblazer with this type of work, and there is no comparator data from Canada. As Lucas mentioned, and I fully agree, I think it is happening. I think machine translation is being used, but at the moment it's a sort of anecdotal stories about it, and we don't have this type of empirical evidence that Lucas has produced with his survey. So work to be done in the Americas, as far as I know. So one example that I can share, though, it's a slightly different because it's a case of a machine translation tool being rolled out, not so much for the public services, but the civil service, so government employees. And of course, in Canada, as you possibly know, we have 2 official languages, so this makes a slightly different situation as well to the one that Lucas has been describing, where there's one official language and potentially many other heritage languages or languages from migrants. So in the Canadian government, we're talking more about an official language situation. But it's a little bit old now, it comes from 2016, but I still think that there are some lessons we can learn from it. So what happened in 2016 was that the government of Canada said that it would make a machine translation tool available to all the public servants, so all of the employees of the government of Canada. And at that time, in 2016, the tool in question was a statistical machine translation tool. That was the sort of state-of-the-art tool at that time, just before we saw the transition to neural machine translation. It was a tool that was specifically created by the National Research Council of Canada. So it wasn't one of these free online tools. It was a tool that could be used in a secure way. And it had also been trained using data from the government of Canada. So all of those factors would sort of point to, potential for success, right? This is a tool that is specifically designed, trained on the relevant data, state-of-the-art technology. And yet it turned out not to be a success story. When this was announced by the government, the reaction was sharp and swift in a primarily backlash kind of way. The popular media exploded with articles about this. A lot of concerns were raised. There were a few supporters. The supporters were primarily the government administrators who had come up with the idea, and also some machine translation researchers who are excited about, you know, the potential of this technology for use in a broader context. But the majority of the news articles were in opposition to this use of the tool. So some of the people opposed were a union representing Government of Canada employees, several different professional language associations for translators and interpreters, a number of members of parliament, primarily from French-speaking regions in Canada. And they framed their objections around three main points. One of the objections was that this would threaten the work of professional translators and, you know, kind of undermine their status as professionals. Another objection was that this would potentially pose a threat to the linguistic quality of the communications, and particularly for communications in French, because if we look at the distribution of citizens, but also federal government employees in Canada, it sort of turns out that around 80 to 85% of documents are written in English and translated into French. Only around 15% are written in French and translated into English. So there would be a much higher volume of machine translation towards French, and a concern that this would have an impact on language quality. But for me, one of the most interesting objections that was raised was that this would actually undermine the rights of public servants who were Francophone under the Official Languages Act, because it would kind of create a situation where English speakers were getting, you know, original language, high quality, well-written text, and French speakers would be getting this kind of crummy, potentially machine translation output, and that this was really creating a two-tiered kind of first and second class citizen situation. The next slide, please, Lucas.
Oops.
So one of the really important lessons learned for me from this situation was that how you present this technology matters. The way that you present the tool can influence a lot how it is perceived and used. And so one of the kind of results of this was that the government realized they really had not consulted properly. And so they immediately halted the project and did a lot more public consultation. So for me, this idea of how you present the tool really does matter. So when Lucas is talking about policy development, having more open discussions about this tool, we really have to think about how we're going to frame it and how we're going to present it to people. So just as a couple of, you know, potential things we could consider, you know, if we present this tool as an equalizer, as it was presented to the public service employees, it was presented as a way of equalizing, you know, making it people could use their own language, nobody would have any problems understanding, we could all communicate in both languages, and it would be great. It would be a boon to bilingualism. In fact, what happened was that some people felt that they were being relegated to a second-class citizen role. So that was not the intent, but it was the unintended result. If we present these tools in policies that are sort of blanket policies, which sort of maybe forbid the use of a tool, set it up as a taboo, then I think what we're going to find is that people might use it anyway, but they're going to do it in secret. And so they're not going to ask for help. They're not going to ask for training on it because they're not supposed to be using it. So they will continue to use it in a kind of in hidden way and not potentially understand what they need to know about it. So these blanket policies are probably not the way to go. As Lucas said, there's a lot of nuance in the way. You know, we can't just say, no, not in healthcare anywhere. Those were great examples about the, you know, asking for visiting hours or navigating around the hospital. You know, those could be valid contexts within healthcare. So we have to be a lot more nuanced in how we're presenting these use cases and identify the really appropriate use cases and the less appropriate ones. The other direction, if we present it as a panacea, which sometimes comes out in maybe popular news reporting, where there's a lot of emphasis on the potential of the tools, if we present them as a magical solution, then people will potentially go on autopilot when they're using it. They're not going to be very critical of their use of this tool. And if we present it as an interim solution, which is also sometimes problematic, we have trouble walking it back afterwards, right? Or it becomes a slippery slope. We might intend for it only to be used in some, particular way, but then it sort of rolls out and becomes the norm in a way that hadn't necessarily been intended. So, and in this particular example that I'm talking about, the Government of Canada had to walk back their planned release of this tool. They did a much more extensive consultation. And interestingly, when they actually did roll it out, they rebranded it, not as a machine translation tool, but as a comprehension tool. They really wanted to emphasize that people could use this tool for their own assimilation of information, for kind of understanding things for themselves, but they were not to be using it in order to share information widely, certainly not in any official kind of capacity. So even though that had, it came out that it had been the intent for this would be the use of the tool, it really wasn't presented that way initially. And so there were some definitely, kind of unintended consequences. Yeah. So one example that has come out, and I find this interesting because as Lucas mentioned, many of the people are using machine translation tools more like an interpreting tool than a translation tool. They're using it in a real-time communication kind of way. So one example of emerging good practices that I'm aware of is the Safe AI guidelines, which are very recent. They just came out over the summer. And they put a focus on issues like end user autonomy, having the choice of whether or not you use a tool and which tool. That you should really only be using these tools if there's evidence of benefit. That transparency is very important, as is accountability. So this was one example that I found of an emerging good practice, although it's more about interpreting than translation at the moment. And then, as luck would have it, just yesterday evening, I stumbled on a document that has been released again by the Government of Canada. It's not specific for machine translation. It's much more about the use of generative AI. About a year ago, the Government of Canada put out a very detailed policy on this use of generative AI within the Government of Canada. But what I discovered yesterday was that they have come up with, the initial policy is very long, very detailed. But what I found yesterday was a sort of short guidance that is called generative AI in your daily work. And it's described as concise best practices and do's and don'ts for using AI in your daily work within the federal government. And when I looked at the list, it's sort of organized into do's and don'ts. I did find one mention of translation. Under the How AI Can Be Used section, it says preparing draft translations of internal documents. What interested me, though, was that there was no kind of comparative piece under the don't, what it can't be used for. There was no mention of translation there at all. So that was interesting. But in the larger framework, they had also come up with a sort of, list of things to consider. And I was really pleased to see that what in this case is really AI literacy aligns with a lot of the issues that we in the translation community have been talking about as important for machine translation literacy. So they do talk about the difference between high and low risk situations, the need for transparency and accountability, privacy and confidentiality issues with the free online tools. They even mention environmental considerations and education and training. So I'm happy to see that this AI literacy is lining up with the things that we have been talking about, because it's very relevant for machine translation literacy as well. And I will stop there and give the floor over to Mary.
Okay, so yeah, moving back over here to Europe, to Finland. We also do not have statistics or any kind of studies on the workers on the ground and how they're using machine translation. That's why we keep calling Lucas's study groundbreaking. It will be good if we can take that survey and use it in other countries to see what's going on there. But anyway, to talk about what's going on in Finland, I also have my first piece of information was also old, from 2018, and it's a tool that was made back in the day, because maybe fewer people know that Finland is also a bilingual country with the languages of Finnish and Swedish. And somebody realized that we have a lot of bilingual data, which is what you build machine translation systems on, that is directly between Finnish and Swedish and did not go through English, which most of the systems did do at that time. And so they made this tool, which was intended for both the general public, that's the simplified user interface, but also translators in the government. I bring it up because this is not unusual that people get together and they want to make a tool. A lot of these have kind of shaky funding, because this one was a consortium of a university and some public funding and some researchers and some commercial. And what happens there, or can happen, is that it starts off with a bang, but then slowly it's either not taken into use or eventually dies. So these kinds of things can happen. But another thing that can happen is that people get excited and they turn to tools. I have long said that it's much easier to get $500,000 to get a new tool than it is to get 20,000 euros to get a good process. And what is needed right now, I think, is much more the process and the emphasis on AI literacy and the training that has come up in both Lucas's and Lynn's talks. And so we kind of need to also be there in the discussions to say, hey, there are tools already, and we're not going to usually beat them. So let's look at what else we can do, because to improve machine translation in use, there are two ways. One is through making better tools, and the other is through working on the end users, so to make sure that they're very knowledgeable about how they're using those tools. And I think right now we're much more in need of the second of those. If you would go forward, Lucas. But what's going on right now on the, not on the ground level like Lucas was looking at, but on the higher level, I've been talking a bit to some of the communication planners who tend to be on the national government level. And what seems to be going on right now is that there are various offices on various levels in various areas, and they seem to all be waking up to the same idea at the same time, that, okay, there is a way we could be offering people a lot more information if we could only figure out a way to do that securely and safely. There are a few small projects started, I believe, on the topic, and these different offices just now are starting to talk to each other and organize seminars and webinars on the topic. And fortunately, they reached out to the research community in Finland to talk about this and say, what can you tell us about what you've learned about the use of machine translation that we could use when we're planning this, what is needed for the future to perhaps make it possible to reach more people than we currently reach. So that's what's going on right now here in Finland. And I think we're going to get everybody else back now.
That's fantastic. Thank you very, very much, Mary, Lynn, and of course Lucas. That was really, really very interesting. There's a number of questions, obviously, that arise from this research and the use of MT and AI in general. One of the key things you mentioned, Lucas, was just how popular MT, Google Translate, was with the users. What sense do you have of the potential risks and their awareness of the potential risks from using MT in a kind of, unstructured way, really?
So I think it's a bit of a mixed bag in the data. So some of them are aware and use it because they felt like they had no other options in that situation. So nurses mentioned a lot of demand for language assistance in the middle of the night, and that seems to be a lot harder. So some of them are aware and use it because they feel like they couldn't do anything else. So another example is a doctor who mentions that happens quite often with him. So everything will be done the way it should be done. So an interpreter will be booked beforehand, and then the appointment goes on with remote interpreting. And then the moment that the doctor hangs up the phone, the patient will come up with 100 questions that were not shared during the interaction itself, right? And you will have a queue of people outside your door who need to be seen. You will be under huge amounts of pressure to be as fast as you can. So those are really difficult situations. And I think that doctor jumps out to me as someone who was aware of the risks, but who felt like it was a calculated judge decision in that case to allow the patient to use machine translation in that case, because often it was the patient who would produce their smartphones and start asking a number of other questions, because you can't, I suppose, allow the patient to just go home with potentially serious questions unanswered at that point. So it's a very difficult decision, I think, to make in that situation. But there were also the cases of professionals who didn't mention any caveats, who said, yeah, this is great. This is really handy. It's fast. It's convenient. He has always done the job for me. And the problem, I think, there is that it's difficult. If you need the tool in the first place, that's probably because you will not be best placed to identify where the tool is going to go wrong, right? When it comes to accuracy in particular. So some mistakes might not be entirely transparent to users if they don't have knowledge of both languages, right? So these assessments of, oh, it always works. We know it always works because nothing tragic has happened. But to what extent information could have been missed, or important information could have been missed in that. So that's really difficult to tell. So I would say it's a mixed bag. So some of them are aware of the risks and use it because they feel like they have to, and others are less aware.
Great. I don't know, Mary or Lynn, whether you have any other thoughts from what you've seen in Canada or Finland in terms of user awareness, in terms of risks?
One thing I can say is that while we might be a little bit frustrated by the place that generative AI has kind of taken in our lives in recent years, it sort of came very quickly. It came without any guidance. It's just sort of everywhere. It seems to be touching all different aspects of our lives. One benefit of this for the purpose of this discussion is that people are aware of the risks of AI in general. They're just helping, to improve, so we've been talking about machine translation literacy since around 2018, 2019, but it was very hard to get that discussion out into the public. It was very hard to get people to talk very specifically about machine translation literacy. With generative AI now, people might have encountered it with image generation or text generation rather than translation. So at least this has given us an opportunity to get in and start talking about risks. What we have to do now is help people connect the dots. Oh, those problems that you're seeing with image generation, that exists for translation too, and here's how. So I think we've got an opportunity now on a bigger stage than we had 5 or 6 years ago to start having these conversations. So that's one potentially silver lining of the situation. Mm-hmm.
And I could throw in here that I have one of the groups I've studied. So I've been studying specifically groups that use machine translation at work. And I studied people who work with patenting. I'll try to do that in British, patenting. And it was an environment where the use of machine translation they've been reading patents in other languages for a good 12, 13 years using raw machine translation, but it is transparent. Everybody knows, everybody's using it. It is discussed. Oh, okay, did you read that over machine translation? Yes, I did. What tool did you use? The boundaries of where it should and should not be used seem to be shared among all. There are certain places you do not go into a court of law, for example, with anything other than human translated documentation. And they had especially looking back now at the time, they have a fairly high level of machine translation literacy. Not only individuals, but also they teach each other. And there are actually guidelines, for example, in the European Patent Office documentation about where is it possible and why. And these people as a group, I mean, the environment is also very risky. So sometimes professionals it's not the awareness of the risk of machine translation so much as the overarching ethics of their profession that guides them in this. You will make sure journalists will say, like, yes, I do that to read material, but of course I check and recheck everything anyway, so I do it with machine translation as well. But in the patent ecosystem, it seemed that there was a very high level of awareness of the risk and methods and strategies for checking and rechecking things to make sure that, and even built into their processes, because otherwise they have safeguards built into their processes already that make it possible to also check the machine translation. So I have seen a case where transparency and education and high machine translation literacy make it possible to make it more safe to use these tools.
Very interesting. Okay, thank you. Once again, looking at your research, Lucas, you were saying that quite often workers effectively were using these tools kind of with a bit of a suggestion that they could by their kind of direct manager or whatever. But what do you think the sort of level of understanding throughout public bodies and public service institutions is around what their workers are actually doing?
So it's difficult to tell, right? I think this is one question that this data, I think, doesn't allow us to answer with certainty in terms of the extent to which that institutions know what's going on the ground. That's difficult to ascertain, I think. But my sense is that in some cases, organizations will be happy to turn a blind eye to what's going on because machine translation plays to their financial interests, right? It will save them money. So I think there will be an immediate disposition to look at these uses in a certain way. And so I don't think we need the data to tell us that, right? The data is not telling me this in any way because the data does not allow us to draw any conclusions about what the institutions know. But I think we can, consider the financial aspect of this as a major driver for institutions to remain silent in terms of what's going on. I don't think they would want to be seen to endorse because it's a moving picture. We don't know, the guidelines are only now emerging, right? So I don't think no institution would want to be seen to be endorsing machine translation, and that would expose them quite a lot. But in terms of what's happening on the ground, my guess is that they would be happy to turn a blind eye to it until an issue, a problem happens, right? And I think when we say a problem happens, I mean, that can take a number of different shapes, because sometimes machine translation use will mask the extent of real language barriers that will be in place. We have a recent case in the UK, not in public services, but I think it's relevant, which was that case of a London girl who died after drinking a hot chocolate from a coffee shop. And the girl's mother asked for the hot chocolate to be made with soy milk because the girl was allergic to dairy. But then the hot chocolate had milk in it. So quite a tragic death. And then it came out in the inquest later that the staff at the coffee chain were using Google Translate to pass the allergy training modules online. So they needed Google Translate as to access the training and to pass the training. So in a case like that, it's not that machine translation caused the death, but I would say that machine translation masked the extent of the language barriers that were in place, because it also became clear during the inquest that there was a communication issue, a language barrier issue in the miscommunication there at the point that the order was placed. So I think institutions have a duty to start discussing this and to come out in the and they're not alone. I think many I think it's difficult to know exactly what to do. I have my comment on guidelines that dictate a model of behavior. I think that's really difficult. What this data shows is that the circumstances that you may find yourself in are so varied. Things can change in a split second. So I really think that education and machine translation literacy and AI literacy is really important to this. And just briefly on the, not to go back to the previous question, but one area where I think users are less aware of the risks is in relation to privacy and information security. I think this is an area to flag where I think the level of awareness is a lot lower compared to the risk of miscommunication and to the risk of mistranslations.
Okay, thank you. And maybe just to add on, in terms of the UK, as COL, we're working in advanced conversations with the all-party parliamentary group on modern languages, looking to have a meeting specifically on this topic, on the need for guidance, policies, regulation, whatever it may be, on MT and AI use here. Mary, Lynn, different perspectives from around the world in terms of knowledge of what people are doing in terms of using MT and AI for translation.
Go ahead, Lynn.
Well, so the way that you phrased the question, I think you said, is there any use of MT and AI that's acceptable? And one of the really problems that I'm grappling with is acceptable to who? Because there's usually two people involved in this communication, right? So we might have a doctor and a patient, we might have an emergency services worker and a bystander who are trying to communicate something. And so for me, like, what is the whose rights are more important? Acceptable to who? If one of the parties is willing to use machine translation, does that mean it's okay? Do both of them have to be willing to use it? And I kind of come back, I mean, maybe because we're talking about medical things, but this idea of informed consent. If a person is willing to take the risk, if they understand the risks around the machine translation use and they're willing to assume those risks, is that an acceptable situation? The problem is, for me, whether they actually do understand the risks. That's a big question. One of the things that I've learned in my work on machine translation literacy is that I started in the wrong place. One of the reasons that people have poor machine translation literacy is because they have poor translation literacy. They don't actually understand the risks of translation in general or the challenges of translation in general. And so that lack of knowledge makes it difficult for them to understand the limits of machine translation as well. So I guess for me, I would just support the Lucas's final comment there, that he said that education is so important, that we really have to raise this awareness. Because to me, it would be an acceptable use of machine translation if there's informed consent and the people are willing to use it. To me, that means that it should be acceptable. But it's like, how informed is their consent is still a bit of a question mark for me. And what would happen if a hospital or a clinic had a policy that said no machine translation, doctors can't use machine translation, but the patient really wanted to? Like, whose rights are more important there? And that is something that is for me still a question mark. I don't have the answer, but it's a conversation we need to have and explore, I think.
And I would like to pick up on 2 points. I was also quite alarmed by the result that it's usually the public service worker who is deciding to use it, because it does go to exactly informed consent, and it kind of puts the regular person they're talking to in a spot that they kind of are forced to accept that. And besides the questions of do they understand risks and stuff, there is a thing that experts are working with genres that they know very well and with subject matters that they know very well. So they are better equipped to deal with machine translation and spot problem areas where it might be mistranslating than the person they're talking to. If we take a doctor-patient situation, then the patient might have a new diagnosis, they know nothing about it, and so they are less well equipped to deal with it than the doctor would be. And yet if it's the doctor or the person who knows better, there's an information misbalance there. And if the one who knows more gets to decide, then that puts the person immediately at a higher risk. The other thing I'd like to bring up is that this idea of masking translation needs or language barriers, I think you put it, Lucas, but it also could mask translation needs, that we should also take, especially in the industry, take a look at where machine translation is being used, because where is machine translation, there is a need for translation. Many of these are things where a professional translator would not be involved, as pointed out, but some are. And I think part of our machine translation literacy should be to say, like, hey, if something keeps getting retranslated by Google over and over again, wouldn't it make sense to get an official translation and make sure everybody has access to it? So I think there is an opportunity there to get out and spot cases and train people to look for those. Right now it's hard to know because there are different individuals who are all retranslating the same material in Google. So, but there are opportunities there. But one final risk I'd like to bring up is that I don't know if I'd call it an opportunity risk, or an opportunity cost risk, that public service workers might learn to rely on Google Translate or on machine translation and not see or develop the processes needed to be able to use a better form of translation. So for example, phone interpretation is a better idea than relying on machine translation, although it's not as good as in-person interpretation, as we all know. But if you don't go through the pain of learning the process to get a phone interpreter, talking to the bosses that we need to have a really fast process, then it might be skipped. And people forget that it's an option even. So people kind of rely on machine translation long enough that they forget other better means of translation.
Yeah, I think that's when that interim solution becomes the solution by kind of default to sort of slippery slope.
And I mean, is it realistic at all, or is it desirable indeed to try and completely stop NT use? You said, Lucas, it was in some ways driven by finances, and people turn by finances. I know we've also had examples of more positive cases, but is that feasible? Is it realistic?
I don't think it's. No, I don't. I think the honest answer is I don't think it is either feasible or realistic. But that does not mean that we should just accept the status quo, right? I don't think there is nothing inevitable about the way that machine translation is being used right now. I think there definitely are things that we could be doing. And what Mary mentioned now is one example of, I think, what could be in a policy. And there are some, policies. I'm thinking of the Standards for Language Access in Courts in the US, for instance, where you need to collect data. You need to know where demand is, what is getting translated. And that, I think, is part of bringing out the use of these tools into the open, so that you know what you're dealing with, right? Because right now we don't. So I think that there are things that we can be doing, and that will seem like low-hanging fruit for institutions. In terms of training and education, we absolutely need to be, emphasizing that, and that could be another element within a policy, the standard of training and support that should be available for professionals. But I really think that telling professionals what to do is hard. I don't think that policies would be around of, if it's this level of risk, you use machine translation. If it doesn't cross that threshold is a moving line. It can move up here in a matter of seconds, and you will not have the time to sort of action a policy that will go into a lot of detail of what to do in cases A, B, C, and D. I think which is working with people and institutions to think around the key competencies that these professionals need to have to make those decisions, I think is potentially a more productive starting point. Not least because I think that there are many open questions. What Lynn says about it's not just one end user. I think this doesn't get talked about enough, right? So usually this is so important. In some existing guidance, you see this idea of end user autonomy, and I totally subscribe to that. But I also think that there will be limits to end user autonomy depending on the end user that you're talking about. We can't turn up to a doctor and ask to be prescribed a specific type of medication. It's their prerogative. I mean, we can't just decide what we're given in that way. So what if a doctor in a situation or interacting with the patient thinks that, look, based on the treatment that I think I'm going to recommend, I need this to be interpreted by a professional because the risks to you are too high. There are cases where we are not given things that we may want, I think. So, but that's an open question. I'm not saying that should, guide decisions around whether machine translation is allowed or not with consent. But I think that's really complex. This is not just a case of, if there's consent, it's fine. I think it's a really difficult question. And on consent as well, this was another. I mean, I didn't mention this in the presentation. I don't think the report goes into detail about this either, because this is mainly in open descriptions of how machine translation was used. Consent jumps out as an area where machine translation is being used to gather consent from service users. And so very problematic, right? Because the informed aspect of consent is immediately in question there. And that is really serious. And this affects many sectors. It's central to healthcare, but also in law enforcement and a number of other public sectors. So this is one problem area, the issue of obtaining consent and what can be classed as informed consent at that point. So it's a complex problem, as I said towards the end of the slide of my presentation.
Thank you, Lucas. And I'm wondering whether we should, because we're getting lots of questions coming in. We have talked a lot about risk, but maybe just as I start to go through the questions, whether maybe Mary, you'd like to comment. As we've talked about risks, COL, we're obviously concerned about the use of NT, and as are our members in many cases. But we've talked a bit about some positive aspects. What can you give some of your thoughts on the potential positive uses of MT and AI?
Yeah, because one question you might have is like, why are they interested in this? Why are these communication planners talking about this? But of course, they're seeing a situation where they have lots and lots of people coming in, newcomers to the community who don't speak the language, and they have a lot of information. Finland's very good at producing information, and there's kind of a chasm that they have to get over to be able to provide it to everyone who needs it. So you can understand the motivation. They want to help people. they want to give people the information they need. And of course, they want to make their lives easier too. Like it helps make processes smooth when people have the information they need. So there is a lot of potential. If again, we can figure out, like, or organizations can figure out the right places to use it and places where more guidance is needed.
Yeah, if I may, Dom, I would actually like to extend your question a little bit, because you asked if it's feasible or realistic to try and stop the use of MT and AI. And I agree with Lucas, it's not feasible, it's not realistic, but I would also say it's not desirable to completely shut down the use of machine translation. What we need really are to identify those use cases where it adds value, and raise awareness about the use cases where it's a really bad idea. There's a lot of gray area in between there, which is why we need more research, we need more input, we need more, kind of to understand better how people are using it and why people are using it. But yeah, I would just add that to your point, and it's not realistic, but it's also not desirable to shut it down completely.
Okay.
Because as Mary said, the potential is huge for,
Thank you. Okay. Well, the questions are flying in, and I'm not quite sure how to do these in the best way. So I'm more or less going to start from the top. And well, here's a point. In the context of healthcare, I would also add that the support provided for MT needs to be realistic for the use case. A&E staff, subject to very tight time constraints in terms of decision making, whether clinically, e.g. a stroke, or at the policy level, need to have these actualities taken into account to be effective. Policy support is key, but based on the realities of the challenges faced. Were there any concrete examples found through the report of any more severe consequences of a professional had for use of MT? So problems that came out. I know you gave the example with the Cafe Nero thing, which wasn't part of the report. But is there a smoking gun, I guess, that you found in terms of MT use at the moment?
I think it was Costa, but no deaths, no tragedies in the data, which I think is a good thing. But there were really difficult examples, I think, to engage with. So I can think of a nurse who mentioned an interaction with the patient. And the nurse was sexually harassed during the interaction through Google Translate. And the nurse just made the point that if there was a human mediating that interaction, I don't think I would have gone through that situation. So that jumped out to me as an example where, wow, I hadn't even thought about this, about just the fact of having a human present. So there were many sort of cases like this, and examples like the one I mentioned at the beginning, where the mental health advocate said that patients who had been sectioned just didn't understand the rights that they had in that situation. But no smoking gun in terms of major tragedies coming up in the data, which is a good thing.
Okay, thank you. Lucas mentioned that 96% surveyed were native English speakers. Did you also ask how many were bilingual versus monolingual? I wonder if there might be a difference in attitude towards MT risk accuracy between those groups. So the first question, whether you asked that, and the question whether there might be a difference in attitude would be very interesting to get Lynn and Mary's feedback as well, being Canada and Finland both bilingual. So yeah,
I did ask that. I asked the sort of the linguistic profile more generally. So a good chunk of the participants had some knowledge of French, but I wouldn't call that bilingual. And by drilling down into the data, it's possible to see as well the ones who listed more than one first language, for instance, and what those languages were. And there were a few in some cases, but that's rare. I think the vast majority of the sample were native speakers of English, in some case with some knowledge of French, but that's it.
Lynn, maybe would you like to, do you think there might be a difference in attitude towards MT from people who are bilingual versus, monolingual?
I think certainly people who are bilingual have the advantage of understanding some of the complexity of translation, right? They've probably themselves at least been in some kind of informal interpreting situation and, searching for words, and this concept doesn't quite match up with that one. So I think that, yes, if you are bilingual, you would have a sort of heightened awareness of the potential for things that could go wrong in a translation scenario. Doesn't necessarily mean you're a machine translation expert, but still, it's an advantage.
And I think my own research has shown that people are often relying on some competence in a second language to translate materials from that language. So they are taking a look at the machine translation and the original and kind of putting together an understanding from both of these. So I think these kind of people, of course, it's a totally different situation than when you are relying utterly on what the machine is giving you. And therefore it's a somewhat different attitude.
Thank you. Okay. Well, I comment here, I'm shocked to learn MT has been used by people with no knowledge of the language to translate. I thought everyone knew it was unreliable and certainly not concrete. There's a number of questions coming in around training and what sort of training you might give to people. Would that be training by a translator interpreter, or training from a computational linguist on how to use MT? There's a variety of questions on how best to train people, basically.
I think Lynn is probably the best person in the world to answer this question. I'll leave it with Lynn.
So even though we're dealing with technology, I don't necessarily think that we need to understand the details of artificial neural networks or transformer architectures. And in fact, this is kind of intimidating to people to suggest that they should understand that, because this is very complex, very computer science work. What I do think is very useful is to help people understand that the tools we have right now, generative AI, neural machine translation, they're what we describe as data-driven tools. And understanding the nature of data, I think, is a very, very important component for people, because, I mean, you can even sort of compare it a little bit to the way that people learn. I mean, machine learning is different than, our actual learning capacity as humans, but there are some comparable points. So if you think even of like teaching a kid how to do something, you might teach them how to tie their shoe. You've got to show them 3-4 times and then they learn it. What people might not realize is that for computers, you can't show them 3 or 4 examples. You have to show them 3 or 4 million examples. And when you start to explain to people, how easy is it to get those examples? Well, maybe with languages like English or Spanish, which are quite widely used around the world, we could find 3 or 4 million examples. But languages that are less widely used, and language pairs where there's not very much translation activity between them, it's harder to find that volume of examples. And of course, we also can't just have examples of any old thing, right? If you want to translate a medical text, you need examples of medical language. You can't be using legal texts or cooking recipes to train it. So I mean, I think when people start to understand just the nature of the data and the type of data that you need, that helps them understand more the limits of these technologies. Also, to appreciate that while you might have a good experience using it in one subject field or with one particular language pair, that doesn't necessarily mean that you'll have the same type of experience when you switch to a different language pair or a different topic that might be more specialized or kind of less common. So yeah, for me, people can grasp data much more easily than they can grasp transformer architecture. And I don't really think you need to understand transformer architecture. I also think that we can, again, leverage the interest that people have in generative AI to use other examples to talk about how this technology works. People understand images, right? People understand photographs. And one of the early applications of Gen AI tools was to generate images. And there's this really kind of fun example, which is called the lone banana problem. And an early attempt to train these tools was to show them images, again, millions of images. And so when they were training the tool, they showed images of bananas, but they were always showing a bunch of bananas. And when they asked the tool to draw one banana, it couldn't. It only was able to produce images of pairs of bananas, groups of bananas, bunches of bananas. And it's like a really simple example that just shows if you don't put the right training data in, if you don't show ever a picture of one banana, these computers are not smart and they don't know what one means. Yeah? And so all they can do is sort of reproduce from examples they've seen. If they've only seen a bunch of bananas, they can't draw one banana. That's much easier for people to grasp than translation for people who aren't translators. So I think we can find ways of leveraging this interest people have in other types of AI applications to help them understand data. And data, for me, is really the key to understanding the strengths and the limits of data-driven translation tools. Sorry, that was a long explanation.
Thank you. Thank you very much. Lots of questions coming in about NT and what what tools were used. Presumably, Lucas, I think you said you generally saw Google Translate was the main, with ChatGPT being used. Various questions about specialized MT engines, which are probably not in the scope of this discussion. But a few questions here about different languages, lower resource languages, ethnic minority languages and so forth, and whether you saw different trends in usage of those, or obviously different results. As we know, there is a variation in quality between different machine translated languages. Italian will be better than certain other languages, and so on and so forth. So is that anything that you've looked at in your research?
So I didn't try. I mean, that's something that this data set I think could help with. But I didn't look at a language-specific analysis to see, for instance, whether the assessment of the users would change slightly depending on what the language was. But their assessment of it was just so overwhelmingly positive that I doubt that there would be some major discrepancies there, based on this data at least. And that may be a result of the fact that demand for different languages was not uniform. So Polish totally dominated the needs in the context covered by this report. So it was it is, I suppose, after English is kind of one of the main languages spoken in the UK, and that's needed in terms of, especially in language services, right? So you can see that in the census. So that didn't come as a surprise. But Arabic was also, there's quite a lot of demand for translations involving Arabic as well. And the users, so the public service professionals, did not have knowledge of those languages. So one thing that was very clear was that the needs did not match the knowledge that they may have had of other languages. So that was very rare. So what Mary was talking about just now, of individuals relying on their own knowledge. So this was rare. I mean, it did happen. So in some cases, French was the language that was needed, but by and large, it was Polish, Arabic, and a few other that I mentioned that in the report. But I haven't looked at a language-specific sort of analysis of their assessments. But I'd be surprised if things changed significantly, given the high level of consistency across the sample on just how popular machine translation was.
Mm-hmm.
But I would say definitely, especially in public services situations where you're really dealing with newcomers, and the official languages are well covered in Finland, for example, and the third unofficial national language of English is well covered. But then when you start talking about Sorani and these languages you did not know existed, and different forms and variants of Arabic, for example, then these are not the ones that are the first ones developed for machine translation. Yeah. And they are definitely, many of them are the low resource languages and language pairs.
Yeah, I think what we can definitely say is that we can expect poorer performance for these languages, right? So, and that's concerning, because I suppose these will be the languages where finding potentially a qualified interpreter in the middle of the night at 3 a.m. will also be harder. So it's a double whammy of it's quite concerning. So yeah, something more research is needed on low resource languages and on trying to level that playing field a little bit.
Okay, thank you. So another question here. Thank you for an extremely interesting, relevant discussion. With regard to Lucas's research that 53.1% usually combined MT with other types of language assistance, were there any notable trends per context concerning whether language assistance was equally as ad hoc, e.g. a bilingual colleague who may not be a specialist, or referral to professional language services and so forth?
So as in, I'm not sure if I understand the question. Depending on different contexts, whether there were some methods that were more used than others.
Yes.
So there will be aspects of the context that will just lend themselves well to, say, Googling and researching things online. So if they were using machine translation for written purposes to distribute leaflets, for instance, or to send letters to patients, this was some of the uses that came up. They were using other methods online to try and double check what they were doing. They would try and ask. So the phrase uses ask a native speaker. So I asked a native speaker to look at it. So that what you gather from that is not a professional translator or a professional service that is being hired at that point. So they were trying these different methods in those situations when it's written information. But in most cases, which is where they were interacting with people in a shared sort of public, in a shared space, it was usually what they had at hand. It may have been other people, sometimes the patient, or sometimes the other person may have some knowledge of English. Sometimes these interactions started in English. The need for the interpreter was not known before the interaction, and maybe the patient thought that everything would be fine in English up until the point where we realize that there's no understanding here, and this is important. So it's a short notice sort of need for you to get an interpreter on the scene in that situation, and it may not be possible depending on the types of services that you will have access to. And that's where machine translation is used. In some cases, machine translation is offered but declined. So that case of patients who are just more comfortable with machine translation, professional interpreting is offered but then declined. So, and then patients will just say, no, I'll just use machine translation. It's what I'm used to. They just get their phones. This works for me. This is what I normally use. There's no need for an interpreter. And then the professional will carry on with that interaction in the way that it goes. So the context, I think, will influence a lot the types of assistance that they will draw on. But I think that the body language multimodality, that plays a huge role in this as well. And there's a lot of research on this in interpreting. So this is not new, because a lot of that will apply to interpreting interactions as well. If we think of how objects from the environment, how our relationship with objects from the environment may have a role in communication. So one example that I can think of is someone who had to explain to patients how to wear a heart monitor, which they would need for a procedure. So that's an object that you'll be able to hold. You'll be able to perhaps demonstrate that on your own body. But then in those situations, the moment that they would say, I could almost get by without any kind of translation at all, but I need consent from the patient to go ahead with that procedure, and it's usually the need for informed consent that would trigger the need for machine translation, which is really, problematic if you think of it.
And could I suggest that one immediate takeaway from this is that there are certain things that really need to be translated, and I think consent forms have come up over and over again, and perhaps this is a good place to start, that these are the kind of things that might get translated over and over again, and there's a large margin for errors there. So
yeah, that's a huge problem. I think not necessarily consent would be obtained through a form in these interactions. I think consent is quite often obtained orally, especially if it's an interaction where it may not be a formal treatment procedure. It may be consent to just wear this heart monitor here really quickly. You know, I think there are different levels and types of consent, and not necessarily that we're talking about the formal, which irrespective of how small or, you know, how momentary the consent is, it's not less important because of that, right? So I think this throws up a number of really difficult questions.
And thank you very much, everyone. We are going to have to wrap it up now. There's still loads more comments and questions coming in, so thank you to everyone who's still on the line. We still have over 216 people live 1 hour and a half later, so thank you everyone there. We could carry on the discussion, I'm sure, for at least another hour or two, but yes, thank you to you, Lucas, for the fantastic piece of research. Thank you, Lynn, for your valuable contributions, and thank you so much, Mary, as well, for your insights. We've run out of time. Just to confirm to everyone that all attendees will receive a certificate and a link to the recording within a few working days. COL members can also log this roundtable event on MyCPD. So once again, thank you very much, Lucas, Lynn, and Mary. Thank you everyone for listening and participating in this roundtable on such an important topic. Thank you all very much, and goodbye.